All right, everybody, it's Steve Anderson. Why don't we get started? This is our first Summit-sponsored webinar, so thanks for being here tonight, and you're our first audience. Maybe you'll give us some feedback at the end of it. This is a good response. We actually had almost 40 people sign up, and frankly, we've had 2 of these live, and we had about anywhere from 5 to about 10 people come. So this was a very, very good response to our webinar, and we'll probably do something like this in the future. There is a handout that should be on the screen there. If you click handouts, there are 3. One is the presentation I'm going to go through here in a minute, and the other is a couple brochures to give you background on prime care coordination. If you don't see those materials or don't have access to them, or maybe you're on a telephone and would like to get copies of anything, call my assistant Debbie tomorrow at 629-3425. That's 629-3425, and she can make sure you got anything you didn't receive tonight. So again, we're glad to have you here. I'm going to work through this presentation. It's very short, probably taking about 10 or 15 minutes. And then if you have questions, there is a chat button that I don't know if you see my chat button on your screen, but if you click on that, you can type in a message, and that will go to me and a couple other folks that are here with me. And we'll try to answer those questions. We'll aggregate them if there are questions of a similar nature and respond. So again, use that chat function on there and just type your questions right in any time during the presentation. So moving on, we're here to talk about prime care. Now let's see if I can get it to move here. Welcome to Prime Care Coordination. And you may be aware already a lot of different things, new things happening in OPWDD. Medicaid Service Coordination is becoming care coordination. That's a distinction we're going to talk about tonight. So Medicaid Service Coordination, known as MSC, is becoming care coordination. And care coordination will have the features you're familiar with, all those things about Medicaid Service Coordination that you know and like, but there are other elements that will be added to it around healthcare providers and providers of services for people with intellectual disabilities. So some of the things you get now through Medicaid waiver will still be a part of it as well, and we'll talk about that as we go along. So care coordination organizations, a number of things I want to speak to here. There are CCOs, you'll hear them called, Care Coordination Organization, and there are 6 being formed across the state of New York and each of the regions. And the goal of OPWDD is to have 2 choices in every region. The Western New York region is very big. It goes from all the way out where we are in far Western New York, all the way down to Binghamton, or at least, I'm sorry, really into that kind of central Rochester and Finger Lakes area, covers most of it. And OPWDD, in concert with the federal government, believes that if we have a system that coordinates care better, and it coordinates all elements of care, medical, dental, behavioral, all those intellectual DD services, I'm going to call IDD as I go forward, that things will be better, that our coordination of care will be better. And they also believe that by creating these care coordination organizations, they can create efficiencies and hopefully put more money back into the system for waiver type services. To get some sense of what the current climate is, there are 462 agencies statewide doing what Summit does, providing Medicaid service coordination. Just in the Finger Lakes in Western New York, there are 67 agencies providing. So a lot of agencies coordinating care for people with developmental and intellectual disabilities. This change affects 2,500 Medicaid service coordinators across the state. And I don't even know how many, it's probably tens of thousands of individuals who actually receive care. So there is some logic to the idea that we might be able to create some efficiencies here, maybe have some cost savings going forward. So what is Prime Care? At the end of the day, Prime Care is a new organization. It's a network of people and services. We are part of a Prime Care that we had a choice between a couple of different ones, and I'll talk about that in a minute, why we chose what we did. But there are 2 care coordination organizations being formed in Western New York, Prime Care and Person-Centered Services. Each will have a network of people and services, and each of them will be focused on people with intellectual and developmental disabilities. So in that sense, they are similar. What makes, I think, MSC different from care coordination is it's a little broader. If you look at this particular chart, you see that we've got those normal support services and the behavioral services we provide for you, and but there are behavioral health services, there are health services, there are wellness services, and you'll learn about these a little bit more. In fact, we're all going to learn about this a little bit more if we go forward. This has happened very quickly over the last few months. These new organizations have been formed pretty quickly, and as you'll see in a minute, we're going to have a launch date of July 1, so it's coming along quickly. This is the partner agencies. There are 16 partner agencies in Prime Care. You'll look at the bottom there, you'll see some that are a little more familiar to you, including Summit, but this is that entire region of Western New York that, like I said, includes the Finger Lakes and some of the areas that clear down to the Binghamton area. So it's a very large catchment area. So why Prime Care coordination? We had a choice between two. Why did we decide to align with Prime Care? We certainly had a choice of either. We thought about this for a long time and decided that what was good for Summit was going to be good for the MSCs that we have now, and also good for the families. Our focus was always on the families and the people we serve. And we felt by Prime Care, we had a little larger say, a little louder voice in how the services were developed. I sit on the board of directors of Prime Care. We're owner of Prime Care. It wouldn't have quite gone that way had we joined Person-Centered Services. We have the ability to shape the model going forward, and we're an equal partner with all the other agencies, all the 16 agencies in this organization. So we just felt that at the end of the day that we could shape what happens for your son or daughter just a little better. Now, moving forward here, there will be two care coordination agencies, as we've talked about. And I'm going to get rid of the screen here for a second so I can see better. So many of the services you've been coordinated by your MSC will now be coordinated by your care manager. So we kind of start getting that new lingo, care management versus Medicaid service coordination. Fortunately, in almost every case, whoever you have for your service coordinator now will also be your care coordinator. Well, at least that's the way we hope it will happen. However, if you do decide to go with the other care coordination organization, we certainly cannot guarantee that would be the case. Okay, why am I not moving to the slide here? There we go. One of the things you'll start to hear about is a life plan. And like your ISP, there's a life plan for your son or daughter that will be developed, but it's a little more comprehensive maybe than you've seen in the past. You'll work with your care manager to develop one life plan for your son or daughter. And the life plan will include access to the network of Prime Care providers that hopefully will support all the needs of your son or daughter. We are currently building that network that will include a lot of the same familiar agencies and individuals that you already know, but also will have some health, behavioral health, and other disability services as we go forward. So it will be a little larger than what you're used to now. So what is the life plan? Well, a life plan, again, has many of those same elements of the ISP, but adds to it what are the desired health, functional outcomes, quality of life measures, what are observable outcomes we hope to achieve, and what are measurable actions for achieving those. What individual waiver service will you get now? And just to repeat that, we'll come back to this in a minute, but whatever waiver service you're getting now, you will get going forward if your son or daughter is still eligible for those. What goals and outcomes will be achieved? What things do we need to do to keep your son or daughter safe? And then what kind of behavioral supports need to be in place? And this is kind of the addition, this next bullet. What health outcomes are we expecting? What conditions, and how do we make sure those conditions are treated? And then the frequency of planned contacts between your care manager and you and your son or daughter. You will have to make a choice, though, not only a choice about what health home, what care coordination organization you want to join, But then there are 2 levels of services provided. You'll see you got 2 columns there to look at: the typical care management that you're kind of used to under the health home care management, and then coordination of all those OPWDD services you're used to now, monitoring health and safety, your medical and dental services, trying to connect you to doctors and dentists that are willing to serve people with intellectual disabilities. What community resources are available? There's some neat software that has been developed that will allow you to have a link, a better technology than you have now. There should be a portal where you can gain access to important information about your son or daughter, but almost as importantly, that will allow the different providers to communicate through one source, one portal as well. And then there will be automatic notifications when providers change or services change. So there's a lot of cool stuff we think will come from that. Notice that last column, not a lot there. If you choose to go with the basic plan, you'll get a basic plan. There'll be a care management and some coordination of your OPWDD services, and that's it. You'll get very little more. As an example, some of the things you may be used to now, but the care manager will not, if you have a son or daughter still in school, interact with your child's school district. Won't help you if you need look for assistance for government supports like food stamps and HEAP and family reimbursement. Help search for recreational opportunities. Work with your MD or your pharmacy to make sure the prescription's correct. So you won't get a lot in that plan, and we really, really do encourage you to enroll in the full base, not the basic plan, but the healthcare home plan when it comes out, and just get the full package right from the beginning. So what about my other services? I've mentioned this already a couple of times, but it's good to mention again. If you have respite with Summit now, you should have respite going forward from Summit. That won't change. If you have a son or daughter that's in a day hab program with People Inc., your son or daughter will get those services going forward. All the providers under the Prime Care will also be a provider under person-centered services and vice versa. So nothing should change there going forward. The other good thing about Prime Care, even though you see that blue area, it's a very large area, obviously, and it's going to cover a lot of territory. But this little circle out here, that last one out there by the lake, that is Western New York, obviously, and that is Summit. We have been chosen as the regional office for Summit. Hub, sometimes it's referred to. We are local. We know the environment here. We have relationships with the medical, behavioral, and IDD providers. So there should be a sense that this is a seamless process, that you're going to be working with folks you know well already, and Summit's going to be involved going forward. But it ultimately will all go under Prime Care, this new organization, as we go forward. So here's sort of in summary the essence of it. You're getting Summit's Medicaid Service Coordination now. You'll be moving to Prime Care Coordination. One thing that's kind of interesting about this is a transition year. So there's a start, well, I'll talk about in a second, July 1, everything becomes official. But for 1 year, everything kind of stays under the hub of Summit, and we'll be under contract with Prime Care Coordination. So a lot of the same people you see now, you're going to see going forward. And that will occur for 1 year. And then July of 2019, things start to change just a little bit, and everything goes under Prime Care Coordination. Summit will still be the regional hub. Summit will still be involved as the Western New York office, but everything will be under the umbrella of Prime Care Coordination, the new company. What are now Medicaid Service Coordinators will become care managers. And if everything goes the way we think it will go, and it should, if you like your care manager now, you can keep your care manager now. Your other services are not changing. If you get services under another organization, you'll still get those. If you have them under Summit, you'll still get those going forward as well. But you have to choose a CCO starting April 1, and you have until June 30th. We really encourage you to do that early, and this is how it will transpire. Enrollment's going to be easy. There will be a letter. I think the letters actually come to Summit at the end of March, so we expect to be getting those letters any day now, but they will be for us to disseminate to people who get their service coordination from Summit. We have 764 individuals who received service coordination from Summit. Our MSCs will make an appointment with you, and we'll talk about the choices you have to make. We'll have an enrollment form with us. We're hoping that you will sign up with Prime Care, and then your MSC will take it from there. It's pretty simple going forward. So, as I mentioned, enrollment starts April 1, 2018. You'll have a care manager. You'll be in a network, which Prime Care is developing. You have a life plan, or your center dollar will have a life plan. And we are really excited about this new chapter. It certainly will be different for some, but probably less, more different for us than it will be for you and your center daughter. I think it'll be fairly seamless for them. Here's a quote from an MSC. We were really worried about how this would affect our MSCs. We've had folks that would work for us for almost 25 years, and they will eventually, over the next year, transition to being employees of Prime Care. That's another reason we chose Prime Care. We really think that the opportunities that are afforded them under the new model is quite good, and we're excited about that. And actually, we've been communicating with them very regularly. We don't expect to lose anyone, but we never know, but we don't expect to lose anyone going forward. They're going to transition to the new organization fully by July of 2019. So that's my quick talk about Prime Care Coordination. See a website there, and a still evolving website, but there's a fair amount of content up there, and a telephone number you can call. Certainly call Summit, or you can talk to your service coordinator, because they're pretty up to date on this as well. I want to see, have any thing come in through the chat? We've got a few minutes here, guys. If you want to type a message in to your to the chat room there, we can answer those. I'll give it a few minutes. Nothing yet. I've got a couple folks here with me. Are we missing anything that I didn't talk about? Should I add anything to the lecture? Well, I must have done one good job because we didn't get anything in the chat at all. But if you certainly have any questions, please call us. And I know a few of you may come on a little bit late. This is recording, and we will get a broadcast out to where you can access it. And of course, the materials will be on our website as well. So you'll have a link to the broadcast, and you'll have the materials should you want to download them later. Thanks for joining us tonight, and all have a good evening.